A major development tonight after insisting that the Senate would move forward with a vote on health care before the July 4th recess. A reversal from the Republican leadership deciding to postpone the vote. It seems the bill just couldn't withstand growing pressure from Republican opponents, and Democrats have been against it since day one.
We're here to show what this bill means. This is not a bill of just paper and pencil. This is not just abstract numbers. These are real people, and every one of these stories represents millions of others who are also affected.
One of those families with serious concerns right here in the inland Northwest. Good evening. Thanks for joining us tonight. I'm Nadine Woodward. Several proposed changes to the bill could impact access to care for diseases with expensive and expansive treatments. KXLY4's Caroline Rourke working for you with a local mom fighting for her son's health from Coeur d'Alene all the way to the Capitol. Caroline?
Nadine, the Congressional Budget Office's review of the Senate's proposed bill estimates that 22 million more people would lose coverage. For families like the Schroeders who live with the effects of a rare disease every day, that's a big deal. For them, the healthcare discussion reaches far beyond politics. At a mature, almost 10 years old, Brady Schroeder counts Joseph Haydn at the top of his favorite musical stylings.
I like to play the song that I practiced for my talent show called German Dance.
Another love, science.
I mostly just like all the cool things you can do with all the stuff, like dry ice, especially that.
Science gives Brady the freedom to experiment, build, and do pretty much anything. Freedom that in the rest of his life has been limited by cystic fibrosis.
It made me have some trouble breathing.
The genetic disease affects Brady's whole body, but mostly his lungs and digestive system. It requires major treatment.
When I first started, I was terrified.
It's, a part-time job for a child with cystic fibrosis to maintain their health. This is breakfast.
But with this job, you pay.
Brady swallows close to 40 pills a day, and that has a cost of over $1,000 a day.
One of those drugs tricks Brady's body into believing that it doesn't have CF, allowing him to live mostly normally. It costs over $32,000 a month.
I am fighting for what I know my child needs and what the foundation that supports us says he needs and what the American Medical Association says he needs.
Rebecca worries that the new health care proposal could limit certain benefits like lifetime caps and Medicaid that keep Brady on treatment.
While my lawmakers understand what it takes to take care of Brady and others that have complex conditions like his, that they are maybe not really listening and understanding the true human impact behind this legislation.
She's been to Washington, D.C. several times to share Brady's story with Idaho lawmakers. But she wants to be clear, this is not about politics.
Any lawmaker that stands up to help me access the things that I need for my child will be my hero.
Rebecca just returned from another trip to Washington. She spoke with Senators Mike Crapo and James Risch. Despite her concerns for what it could mean to her family, Rebecca says both lawmakers indicated that they might lean towards supporting the bill. Senator Crapo, in fact, has actually publicly expressed his support in a statement on his website. Senator Risch, at last check, was still reviewing it.
So, Caroline, what will Rebecca do next?
That's a good question, Nadine. She says she will keep contacting lawmakers and making her case, sharing Brady's story, especially now that she will have a few extra days since the vote has been tabled. We will keep in touch with her as well as the vote gets closer and let you know how that story develops. In studio tonight, Caroline Rourke, KXLY4 News.
Thank you, Caroline.